Awesome. All right, great. Thank you very much. I show it's like 1 minute after the hour. I know Vicki and I have a lot to talk about today, a lot to kind of take in, all of that kind of stuff. So I think I'm just going to get us kicked off and started today. So again, thank you all for joining us for our presentation. We're going to be talking about really, empowering voices, exploring some survey data that we did to support family leaders and systems change. My name is Molly Martzke. I am here at Expecting Health with the National Genetics Education Family Support Center, which we call the Family Center. So I will just talk a little bit about, again, if you want to go to the next slide, Vic, we will talk about the Family Center just a teeny bit. So the Family Center is a HRSA-funded program. Here is our disclaimer. We are very thankful for the support from HRSA to do this work. And yeah, so again, I will do a little bit of introduction about myself. Vicki can talk about herself. We'll talk about our agenda, kind of what we hope to accomplish today, and then we'll get right into some of that survey data that we collected. So again, my name is Molly Martzke. I am Senior Program Manager here at Expecting Health. I have been doing this work around family leadership and family engagement for a long time in lots of different systems, whether that was local systems, regional systems, national systems, whether it's children and youth with special health care needs, the early hearing detection and intervention, as well as in this genetic space. I came into this work again several years ago. I am a parent. I have 3 adult children now, and 2 of my kids are deaf. And so again, that's sort of what brought me into this space, and where I like to kind of again see how it's evolved over the years, how it's changed, how we've learned, and stuff like that. So that is a little bit about me. I'm going to let Vicki introduce herself, and then, like I said, we'll get us kicked off.
All right. Thanks, Molly. My name is Vicki Hunting. I am the Senior Manager of Operations and Growth here at Expecting Health. I am the parent of a young adult who is deaf and also been involved in the system for over 20 years at various levels, starting out at my local state level, looking for other opportunities, understanding how to find those opportunities, and working in various parts of the system. The genetics healthcare delivery system was new to me in the last couple of years. And so I've enjoyed learning about another system, but also being able to see the similarities between the newborn hearing screening system and the genetics healthcare system. So I think that's it. Molly, if you want to jump into what we're going to talk about today.
Yeah, absolutely. Thanks, Vic. So, today's discussion is really gonna center around, I'll lay some background. We'll talk about some of the things that the Family Center has done to look around family engagement, what family engagement looks like in the genetic system. Like Vicki said, all of the work that the Family Center has done is really centered around the genetics healthcare system, but there's pieces of that can be extrapolated and put into other systems of care and stuff like that. But again, I just want to let you know, our focus really has been in that genetic space. So first we'll go into some background. The Family Center back in 2020 released a report around exploring the role of families in the RGNs, really looking at how RGNs were involved in engaging families within that system. Then we'll move to a report that was released last year, where it was really where we looked at understanding what family engagement in genetics looks like. So this report really looked at those perspectives from family leaders. So that first one was sort of asking the RGNs and the professionals like, hey, how are you engaging with families? Whereas that next report sort of took it to that next step, where it was really talking from the perspective of family leaders in the genetic system. And, how are you involved and what do you like to see? And then lastly, where we'll spend the bulk of our time today is really around our family leadership survey, the development of that, how we looked and how we sort of expanded the previous work of those 2 reports to really look at including family leaders outside of this regional genetics networks world, but are still within that genetic system, and to really dive a little bit deeper into what families feel like they need to be involved in systems type work. So, next slide. So as we're looking at this, I just want to sort of like lay this foundation for us around this journey of a family leader. You'll hear Vicki and I talk and use that term quite a bit. So I just want to let people sort of know what we're thinking about when we talk about a family leader. So we really talk about how families get involved and how they kind of get involved in this system level work. So we look at this graphic as sort of a lens, and usually, again, a family will kind of they start for themselves. It's sort of they're trying to figure out that diagnosis, or if they don't have a diagnosis, what they're trying to work towards and stuff like that. And once they get that, they kind of then they might move into doing it for community. So it's sort of like they start to connect with other families, they connect with other individuals, and so they'll do it in that sort of peer-to-peer, that networking collaboration sort of mode. And then again, as some of those skills and confidence grow, they might lend that voice to the system and sort of trying to do it for a systems change, systems improvement, making it better for somebody who is coming along behind them or something like that. So a couple of the things I want to talk about when I talk about a family leader is that it's not a linear journey, and that it's also not like an end goal. So it's not that every family that gets a diagnosis is really looking to be this family leader and change systems and do all of that, that's not really the end goal for all of this, that it's more this, again, it's sort of that individual level. And sometimes you might be working and doing something for the system and decide, you know what, that's not really for me. And you might pull back and do something that's more community and again, just supporting maybe another family or something like that. Otherwise, again, it might just be for your own self and your own family. So I always say that a family leader really is if that individual can go to that healthcare appointment and get from that provider what they need from that visit, that's leadership, because the way things are, it's not always as simple or as easy as it should be. So we take this very sort of overall encompassing view of leadership and what family leaders really look like as they operate. So, all right, next slide. Like I mentioned, so back in April of 2020, we released this report. It was really exploring the role of families in the RGN, so in the regional genetics networks. And it really concentrated on how RGNs involve families and how they're involved and engaged in genetics. So the next slide. So again, so the report summary was really to explore that family engagement across the 7 RGNs, the ways that families were involved. It was an opportunity to capture kind of what activities RGNs were doing to engage families and to better understand sort of that evolution and impact of family engagement on genetic services. So for the purposes of this report, family engagement, it really was encompassing those range of approaches through which they were interacting. So maybe it was informal discussions, consultations, collaborations, partnerships, sort of that like a continuum of how they were involved with the RGNs and whether they were on different committees or stuff like that. We talked about in that report the complexity and assessment and reporting on family involvement. And there was a needs assessment that was done that really sort of identified, some activities, facilitators, and barriers and successes for the RGNs, for families to engage within the RGNs. So next slide. So again, some of those key themes that we found. So when you look around these, family engagement activities, they really looked at what some of those tactics and methods that were being used by the RGNs to involve families, sort of those facilitators, again, some of those barriers and successes. So, for example, partnering with families to host local events to educate communities about genetics. They were leading projects, attending annual RGN conferences, that type of work. Again, this report and this work was really done to really understand more from that system level down about how families were involved with the RGNs and less about like how families were feeling themselves being involved. So, all right, so next slide. That led us to this report that was released in 2022. So this was really understanding family engagement and genetic services. So we really took that foundational work that was done in 2020, and then we really wanted to get from family leaders their perspectives in the genetics healthcare system. So what we really did is we conducted a lot of focus groups. We talked to families. We were trying to understand what meaningful family engagement meant in practice to them and how we could strengthen that relationship between family leaders and organizations. So it really was talking, we moved from these ideas of even some of our language choices that were used maybe in the first report of family representatives to something, again, where we talked about in the beginning, to family leaders. So we talked about that sort of that progression and that thinking of having families as those equal stakeholders in the systems change. Next slide. So again, this report, and both of these reports are on the Family Center website, which I'll include the links included on the last slide or whatever. But so this one includes the perspectives of family leaders, where there were opportunities for improvement. So again, where maybe they weren't feeling as involved or where there could potentially be more involved and some recommendations on how to increase that. And then lastly, we really started to take this stab at what would measuring family engagement within this regional genetics network, within this smaller slice of that system, what that might look like. So we identified 3 different domains and potential areas for measurement in that. So whether that was in infrastructure, so how the organization or initiatives are set up or how they're carrying out work, sort of that operations where it's that day-to-day activities involving families, or whether we were really trying to assess impact, so addressing what happened as a result of families. So it was really this, growing the role of families in designing, interpreting, reporting, being really active participants in those co-production of services and how their involvement impacted that. So again, that report sort of laid out some of that. Next slide. Um, and as a result, again, of reports, we came up with, some different recommendations. So while there's this global understanding of family engagement within the RGM system, there wasn't really a focus on, an institutionalized definition of family engagement, what that meant, where we also recommended that where there were opportunities to measure impact, to establish family engagement performance measures, because that currently isn't or wasn't happening, and ways to pilot, categorize, bolster meaningful family engagement within the system, as well as to monitor it. So, it's really looking at adopting that uniform and shared definition so that someday we might be able to see sort of a uniform standard definition of family engagement across all systems, as well as then we can start to, once we see that standardization at that system level, then we can start to see some continuous accountability as we track, monitor, and manage sort of that goals of family engagement across the system. So, like I said, this is just sort of a highlight of where we were, where we sort of evolved, and that kind of brings us again, sort of to this bulk of what we want to talk about today, which is our next report. So this one is not on the website. We had hoped to have it all through all of our approval processes, and it's not quite there yet. So, but we will hope to have that released soon. And once we do, everybody that's registered for this webinar, we will send that out to you. And again, we'll probably make another splash and put that out on our website. But really, so those two first reports, those focus groups, all of that work really led us to this piece of it. And it's really looking at supporting family leaders for successful engagement in genetic services. So it led us to this question of asking ourselves, what do families need to be able to participate in the system? Next slide. Again, Vicky's going to spend some time. She'll dive into the data. She'll dive into like some of our methods, how we approach the work, but some key overarching things that we found. Again, family leaders' participation in systems work doesn't mean that they're ready and comfortable with their skills or knowledge to engage meaningfully. So just because they might be participating, it doesn't always ensure, that they're comfortable doing it. So we ask ourselves, like, what can we do to ensure families are equipped for their interactions? Um, we know that family leaders learn from each other, that they build confidence, they build skills, knowledge, and self-efficacy through community. Once they hear somebody talking about themselves as a family leader, they start to see themselves as a family leader. And we saw that through our training and through some of our data that we collected. And then again, it kind of goes back to that slide I shared before about that family leader journey around this idea of building community and sharing of information and how important that is to family leaders of really how they gather what they have and then they want to share it back and they want to share it with their groups and with with their networks as well. And we'll have a few recommendations around, again, how we can support family leader participation with compensation. We, this has been a huge topic. It has been talked about. Vicki and I both have been in this work for a long, long time. And I remember back in the day, it was families should be compensated for their work. And we were, I still couldn't believe I was still I wasn't surprised, but I was surprised still by the percentage of family leaders who do participate with systems and don't receive compensation, which feels like a very basic kind of thing to me. We'll talk about, pilot ways to pilot again to bolster the support so that families feel like that they can really meaningfully interact within the genetic system. And then again, providing these opportunities for them to learn from one another and build those communities so that they can, again, be active and equal stakeholders in this process. So, all right, I'm going to turn it over to Vic so she can kind of get into all of the nitty gritty of all of this.
All right, so let's take a look at this work. So this survey was first administered as a focus group activity in April of 2023 at a family leadership workshop in Washington, D.C. I would like to say that the initial work on this survey would not have been possible without the insight, the knowledge, the experience, and the expertise of those family leaders who attended this workshop. They were instrumental in this. This survey provided an opportunity for family leaders to share their voice and inform the genetics healthcare delivery system on the importance of meaningfully engaging families and individuals in the system's work. The survey was intended to gather feedback from family leaders about their journey in this role, to understand the responsibilities they have, identify opportunities that the work has provided for their family, for their local community, and the larger genetics healthcare delivery system, and what matters to them to be meaningfully engaged as a family leader. So in an attempt to get everyone on the same page, or at least in the same chapter of this book, we started with definitions. A family leader is an individual who participates actively in their own health care, in the care of others. They raise awareness in the community. They share their story with others. They advocate for a cause, or they're also interested in learning more for themselves and their family members, and then sharing what they've learned. While we thought we had clear definitions during the pilot, the group participants still had questions. Though they felt like the word participate was too broad and would like to have some examples. So that's how some of those other words came into the definition. With any given family leader, the journey.
Vic, I'm sorry to interrupt. There's a couple things in the chat saying that it's a little bit hard to hear you. I don't know if there's something you can
Okay.
do to adjust or talk a little louder, maybe?
Yeah, I can do that.
I didn't want you to go too far without.
Okay, that's good. All right, so I will start with here. I hope that's better. I'm sorry, I'm not looking at the chat, so if wave your hands if it's still not better. Okay, so with any given family leader, the journey will likely to change over time. We become more comfortable with our family story, our experience in the system, and we may want to move to a more involved role. In my case, my journey attending a first conference thinking, what am I doing here? I can't even recite the mission and vision of the organization without a cheat sheet. And as I participated more and became involved with others, my confidence increased. The genetic healthcare delivery system includes all the institutions, organizations, people, and resources involved in genetics and genomics that help individuals stay healthy. In clinical genetics, this might include testing, diagnosis, counseling, and treatment. It can be public or private. So this needed defining as well because several participants did not understand what this system was that they were in. So when we have worked in a particular system for a time, we're pretty comfortable with these kinds of terms and they are common to us. Families new to this journey don't understand this vocabulary as it hasn't been part of their world. So when we're engaging with families in training or education who are just starting on this journey, we should always include discussions on the terms that we use. Family engagement. Patients, families, their representatives, and health professionals working in active partnership at various levels across the healthcare system to improve health and healthcare. This involvement improves individuals and families' access to genetic information and services. It is critical to engage family leaders at various levels across the genetic healthcare delivery system so their perspectives can help shape the care and resources provided. So this reference definition came directly from the original HRSA, Health Resources Services Administration funding opportunity for the National Genetics Education and Family Support Program, the Family Center, that was released in 2019. Again, we need to ensure that others understand the terms we use in our work. In addition, we believe that systematic changes will be necessary to establish family engagement as a standard operating procedure for public and private programs and the agencies that serve children and their families. And that it isn't just something that's an add-on to be remembered. Oh yeah, we need to involve families in our work. So a little background and logistics on this survey. The survey was distributed to over 7,000 individual email addresses. We're aware that some distribution lists included a high number of individual email addresses, and we know that their primary populations were not specific to family leaders who participate in the genetic healthcare delivery system, but we chose to distribute to those trusted sources who would then share with our specific intended population. We purposely did not post the survey on public social media platforms to reduce the possibility of invasion of spam, bots, and AI responses, but the spam happened anyway. So to combat this, we utilized a free online tool to verify email and IP addresses to identify those at-risk responses. The IP address tool lookup provided us with details about the reputation, blacklist, spam, or abuse risk with high fraud scores. The email address verifier validator tool revealed the validity of the address, spam, complaints, scams, fraud, or abuse threats. In addition to using these tools, answers were compared across the survey to check consistency and help to ensure that the 104 respondents were indeed legitimate. We looked at the start and end date, the time that it took to complete the survey. Were there multiple surveys completed at the exact same time? Those were pretty easy to spot. We filtered and compared answers to questions. For example, what system of care are you involved in or participating in today versus I'm not involved. We also compared answers to how are you involved in these systems, the regional genetic network, the family center, rare disease advocacy, newborn screening, etc. And then using the I'm not involved and I don't know as markers. So in today's world, we know that the spam, the bots, and the AI are going to come into play. So let's dig into our findings. We asked how long participants have been participating as a family leader in the genetics healthcare delivery system, including if you were paid for participating or not. And what we found that 50% of the respondents have been involved in the system for almost 10 years. So the blue and the orange pie pieces. And when we compared that to how they were paid in the system, we found that 66% were compensated in some way, like via a stipend, they received an hourly wage, or their expenses were covered during travel. 34% of all respondents indicated they are not paid for their participation. If we add the next pie piece, the gray piece for the 15 to 20 years, we learned that overall 70% of the participants are paid in some way. While the gap is only about 4% here, there's still work to be done so that more family leaders are compensated early and throughout their involvement. So a bit more in comparison of these questions. In a separate question, we asked, how are you compensated in the system? So overall, that was spread out pretty evenly. 25% were paid via a stipend, 22% are not paid, 20% have their expenses covered while participating, 14% are paid with no benefits, and 11% are paid hourly with benefits. When asked what family leaders needed more of to build their confidence and skills and experience to participate in system level opportunities, it was really evenly spread. And again, this was a select all the apply answer. So 32% wanted training or education that includes a certificate, like a certificate of participation. Not necessarily a certification in something, but just a certificate of participation. 34% wanted to have a place to go to find opportunities so that they could participate further, because those opportunities are hard to find. 34% identified opportunities to engage with other individuals and families on this journey. How do they be together in community? When looking at the diversity of respondents to this survey, 74% of the respondents indicated they were white, 15% indicated they were Black or African American, 9% indicated they were Hispanic, Latino, or of Spanish origin. When we looked at the responses to this survey for non-white respondents, 41% felt like they see themselves and their family demographics represented in the genetics healthcare delivery system. So there's still work to be done here to increase that statement. Oops, sorry, I scrolled the wrong way. Okay, next we asked the survey respondents, how do you identify your role in supporting families engaged in the genetics healthcare delivery system? And again, let's check all that apply. So you can see that people are wearing lots of different hats. Our intended audience of parents, caregivers, and families was at 92%. 55% of them also indicated that they were part of a family-based organization. Then it goes down from there. They're involved in public health programs. The other respondents indicated they were also a tribal representative, a service coordinator. They were part of a nonprofit organization. They were a family resource specialist in early intervention program. they were a family advocate or a family support navigator. We also asked, what kinds of activities do you do when you're participating within the genetics healthcare delivery system space? We wanted to understand what they're doing in the system, and these are their responses. Many of these activities are highlighted later in the free-form question when we ask what they're most proud of, and we'll look at those in a little more detail in a few minutes. But if you look at the top 3 or 4, they're attending and presenting. So they're developing content so that they can present at conferences. They're raising awareness about specific conditions and bringing their experience to that work. They're providing direct support to families, sharing their journey on this path, and they're building community. When asked what kind of involvement they have had in these systems, this is for all respondents, 71% have participated in activities in these in the healthcare genetics space in these systems, and most of them are also viewing websites and social media. So we looked a little deeper at specifically at those 74 participants that said they've participated in activities and programs. And what we found was that only half of them had viewed the websites of the organizations they're participating with. Looking again at the 74 participants who have participated in activities or programs, only 42% have viewed their social media for these organizations they're participating with. So we wonder how they're reaching these family leaders, if not via website or social media. For this cohort, anyway, it seems that they're not engaging in this way. So something to think about. How are us as organizations getting the information out there about opportunities? So I know that there's a lot of words on this slide, and I mainly wanted to highlight the variety of questions that we asked about their overall personal perspective on their participation in the genetics healthcare delivery system. We're going to talk about the blue ones a little more in a few minutes, but I wanted to highlight a couple of these orange ones. So the first one, A, 93% considered themselves a family leader. And that was the 93% is a positive response. So they said strongly agree or agree. In G, 89% said because of my participation, I have formed new relationships that I would not have had the opportunity to otherwise. In H, 87% said that meeting and networking with other parents and caregivers encouraged me in my own family situation. In L, 87% said each time I participate in opportunities to be a family leader, the more confident and empowered I feel. And in the last one on the bottom right, 29%. This is part of the more work to be done category. Family and individual engagement is embedded in the genetics healthcare delivery system and not considered an add-on. 32% said they agree with this statement or strongly agree that this is a true statement. So these are the ones in blue that I wanted to just talk a little bit more about and highlight a couple of these areas. And so these we're considering a positive response that they strongly agree or agree. So in the first row, I feel like that my participation in the genetics healthcare delivery system has increased my knowledge, skills, and ability to serve as a leader. 90% strongly agreed that this was true. In the second row, 93% feel comfortable and empowered to share their personal perspectives on sensitive topics. In the third row, 95% feel like their participation gives me confidence to further advocate for my own care, my child's care, in my community, and in the larger genetic system. And in the last row, 98% are sharing information that they learn with others. So the next questions were free-form questions, and so these are some of the responses. So thinking about situations where you have taken a leadership role during the last year, what actions are you most proud of? And we asked this question to get a sense of the participants' voices and to give them an opportunity to indicate the kinds of leadership they think are noteworthy. What makes them the most proud? So what they had to say was participating in advisory councils and being a parent representative for families with rare metabolic conditions, presenting at local, state, and national conferences, collaborating directly with their senators and representatives to raise awareness about rare diseases, having the opportunity to share their parent perspective with professionals and other stakeholders in the system and seeing it make a difference, providing direct support to families, facilitating support groups, seeing families thrive and making it and seeing that this work that they did made a difference for families. And then creation and publication of materials and resources that support families. So the next question, what has changed for you as a result of participating in leadership roles? So we asked this question to get an idea of how participants reflect and define on why they think their stories constitute success, and then compare that to their own views on success. So this then begins to shape a leadership story. So they said that they were feeling more confident by being in a leadership role, being involved, increasing their self-esteem, interactions with and asking questions of healthcare professionals, and then pushing back if it didn't feel right. Trust your gut. Telling my family story, their confidence was built up, feeling part of the decision making, understanding local community resources that they can share with others. They gained a stronger voice for their family. They felt respected and valued member of their team. Networking with a larger group of people, building more connections, creating and growing their network, building their community, and making lifelong friends that they would not have otherwise met. Their passion was deepened for helping others. There were several who said they left their day job to work in the system. More learning. It also more learning for me and from others. I learned more from others by being in community with them. It increased my understanding of the larger system. I'm less afraid to speak up and share the reality of raising a child with a rare diagnosis. So then we also asked just a free-form general question to that they can talk about anything throughout the system, and just highlighting a few of those. They feel like more opportunities for training need to take place. They also wanted to say that treatments and caregiving can be very expensive and how to deal with these costs. Not all families have access to these other resources and involvement. Where does the funding come from? Making sure that family engagement and that we're building up family leaders. There's lots of funding cuts in systems today. They wanted to say that their peer support of each other on this journey is so important. Even if you're talking to another parent who doesn't have the same diagnosis, you're still on a journey, and there is some camaraderie in that. And then more opportunities for parents and caregivers to connect in a learning mode as well as socially. You know, if you go to a meeting and you have time during lunch or during a break to visit with someone and learn more about them, that expands your communication and your role. Okay, so this is just a couple of data points from the pre and post eval that we did with the Family Leadership Workshop in April. I think that this supports many of the things that we've been talking about. So if we look at the first one, the family leader perspective, there were two questions shown here on the blue bars. The understanding of what a family leader is from before the workshop started was 47%. And then after the workshop, it was 86%. After there had been a discussion, there were family leaders who participated who didn't think of themselves as a family leader, but just by virtue of being present in this workshop, they were a family leader. The orange line was how participants considered themselves as a family leader, from 63% pre-workshop to 82% post-workshop. The next graph shows some information about family leadership involvement. Three similar areas on their involvement in system level work, pre and post, their comfort level participating at the systems level, and then finally their statement that they will look for additional opportunities. There were participants in this workshop, it was a total of 32 participants, that when they came there, didn't even want to speak out individually in that small group. But by the time they were done, they felt that confidence and they felt like they would now better equipped and came to the realization that they can go look for other opportunities in the system to make a difference. Okay, so as we try to wrap this up a little bit and combine some of our thoughts, what are the opportunities for exploration as we continue on this path of working to understand what families need and want so that they can participate in change at a system level? So continuing to understand our understanding of what families need and want to participate as equal stakeholders, being able to speak up about ensuring that families are engaged in all aspects of the system at the beginning and throughout our work. How do family leaders' needs change based upon participation within local, state, and federal systems? I think we talked a lot about that. We saw that when families have the opportunity to participate at these levels, their confidence, skills, and abilities to share their voice increase. They become more confident and better equipped in collaboration with other families, with their peers, with professionals, and other stakeholders. What effects do state and federal funding have on leadership development and involvement? Wow, this feels really hard right now, especially in the genetics healthcare delivery system. We need to be diligent as individuals and organizations talking to our legislators and leaders in systems to make sure that this reduction in funding doesn't equate to families not being paid for their expertise in raising children and youth with special health care needs. Professionals who participate in systems are paid. We need to make sure that families are also paid for their expertise. So just some other thoughts about what attendees to this webinar today can do for their family in their local community and in their larger system of care. Think about and create opportunities within our own organizations for family leaders to participate with peers and other system stakeholders. Attending in-person conferences and meetings where stakeholders gather to discuss topics important to families helps build community. It raises awareness. It provides family with learning opportunities to grow and build their skills and confidence. Yes, these things take money. We have to now be more resourceful about where to find these monetary resources and look for other like organizations who could support families attending conferences or meetings like this. Sertoma Lions Club, for example, other service-based organizations. Funding at the federal level is hard right now, so looking elsewhere will help, and it doesn't hurt to ask. I'd say be an avid communicator. When you read about an opportunity, share it widely within your networks. So with that, our portion has come to an end. Molly, if you have some other thoughts that you want to share, we're going to share our contact information in just a moment, open it up for questions, and then maybe Dr. Ebony then can look through the chat. But if you would please take our post-evaluation. Your feedback is important to us, and we use that information to make things better. I'm just going to skip through this to our contact slide, and Molly, and then Dr. after of me.
All right, thanks, Vic. Yeah, again, Vicky and I probably neglected to say this, but I've been watching the chat as well, Vic, and you know, honestly, we'd love any feedback you have or any comments or any questions. Did anything strike you? I know it was a lot of data at the end, and sometimes that can take a lot to absorb, and take a lot to think about, but again, some of the things, I don't know if others were surprised as I was. Again, that compensation wasn't 100% because again, I feel like to me, it was at that very basic level that I feel like we've been talking about this for 20 years and such a high percentage. Again, Vic, I think you said it was 34%, 36%, like almost a third. And I can't believe it almost. Again, it because to me it seems like at that very basic of wanting to have families show up and help improve systems and still not happening. So so again, I would love to see any comments in the chats or if you have any questions about things that we did. Like I said, the report is in its final sort of review. It has to go through its review process and stuff like that. So we're hoping in the next couple of weeks, early February, mid-February, hopefully we'll be able to get that released and sent out, and we will include that with to everybody that registered here, as well as, of course, it'll be on our website. And Lynn said there will be less chances for compensation with the closure of the RGNs. That goes back to Vicky's saying about how it's getting harder and harder with some of those funding sources we have traditionally relied upon as family leaders, especially as we kind of work through some of this. So again, I think we have been involved in different systems, Vicki and I both, again, different states, different types of systems. And we've also seen some very creative ways of people figuring out ways to compensate families. Maybe, again, maybe the state says we can't do it this way, but people have figured it out, I feel like, in very creative ways. So,
All right. Questions, comments, surprises?
surprises, not surprises. I don't
All
know,
right.
I
Well,
guess. So
we
yeah,
don't have anything else. Please complete the evaluation. We're so appreciative that you could come and join us in this conversation today.
yeah, and absolutely. And again, if something strikes you as you like think about it later, please reach out to Vicki and I. We're happy to have conversations about this. This is something we're both super passionate about, continuing to understand this, understand what family leaders need as they continue to work through and create systems change. So thank you.